Hey people, it's Nias talking. This is from CNBC. Pfizer CEO hasn't gotten his COVID vaccine yet, saying he doesn't want to cut in line. Pfizer CEO Albert Bourla hasn't received his company's COVID-19 vaccine shot yet, saying Monday he and other executives will not cut the line as US officials kick off a massive effort to distribute the vaccine across the country. I just want to say something. I saw somebody said, which really makes sense. If the vaccine really worked, it would be massively expensive like other things you need, like insulin. The vaccine, which Pfizer developed in partnership with Germany-based BioNTech, is the first approved for emergency use in the US to prevent COVID-19. The Food and Drug Administration on Friday authorized the vaccine for use in people 16 and older, and the Centers for Disease Control and Prevention on Sunday officially recommended its use. However, there are limited doses available, and as such, the CDC has recommended states prioritize healthcare workers and long-term care residents for initial distribution. While Bourla's company developed the vaccine, he is not a frontline healthcare worker himself. He has also said he is 59 and in relatively good health, so it's not entirely appropriate for him to receive the vaccine before other people who need it more. If he was vaccinated on camera, he said it might help increase the public's willingness to receive it, citing Pfizer's internal research. I want to quote this post I saw, which was really funny but made a lot of sense. He said, "I don't understand why politicians and doctors think injecting themselves is going to make other people want to inject themselves. I've seen people inject themselves with heroin, but it's never made me want to do it." But really good point. We emphasized that none of the executives and board members will cut the line. Bourla also urged Americans to trust science and encourage people to get vaccinated when appropriate, based on their age and occupation. "I want to tell you people, remember, science once said that smoking was good for you." This is a vaccine that was developed without cutting corners from a company with 171 years of credentials, Bourla said Monday on Squawk Box. This is a vaccine that was developed in the spotlight in the daylight with all the data being put in a server. "I want people to remember this is one of the fastest developed vaccines ever. It takes 5 years on average to develop a vaccine. This has taken less than a year. And remember, although it's not talked about, Pfizer has a long history of medical malpractice with like the trials in Nigeria with the polio vaccine, which left many people crippled. Children crippled. Bourla's comments come as the first deliveries of doses are said to arrive at more than 100 of the country's 636 predetermined distribution sites. Some frontline healthcare workers are due to be vaccinated as soon as Monday morning, and vaccination is said to begin among long-term care residents next week, according to Operation Warp Speed officials. It's a monumental logistic challenge. The federal government has partnered with UPS, FedEx, McKesson, CVS, Walgreens, among others, to help distribute the vaccine and actually administer it. But state immunization officials have warned that so-called last-mile delivery of the vaccine will be most challenging, and states are largely responsible for that effort. State officials have repeatedly called on the federal government to provide more funding to hasten the effort. The vaccine could not arrive soon enough. The U.S. is approaching the heart-wrenching milestone of 300,000 deaths caused by COVID-19. Top U.S. health officials, including CDC. I just want to say something. If there were really 300,000 black people who had died of it, nobody would care, and there wouldn't be any urgency. That's how you know that black people are not dying of it, because if they were dying of it, there would be no urgency. You know that. The top U.S. health officials, including CDC Director Robert Redfield, have warned that the rate of death is unlikely to slow for months, even as a vaccine is rolled out. That's because the U.S. doesn't have enough doses to broadly vaccine throughout the population of 331 million Americans, and needs to prioritize the country's most vulnerable and essential. Alex Azar, Secretary of the Department of Health and Human Services, which has partnered with the Department of Defense to run Operation Warp Speed, said Monday on the Today Show that the general population could begin getting vaccinations by the end of February or early March. Dr. Celine Gounder, a member of President-elect Joe Biden's COVID-19 advisory board, later Monday called it a fairly optimistic timeline on CNN. And remember, they want to prioritize the black population. I know the figure was said here, but it's been said in many other articles that they want to get the Tijuana black American population vaccinated because they are the most vulnerable. But when Tijuana black Americans ask for reparations or any of the unjust policies that have been imposed upon them over the centuries to be undone and for things to be fixed, they get told to pull themselves up by their bootstraps. So I'm going to leave this article in the description. Please comment, rate, share, and subscribe. Peace.